To Heads Up's weekly live stream. I'm your host, Dave Korsunski, and my co host here is Dr. John Lemansky, our Chief Medical Officer. Doc, good to connect with you again. How's your day treating you so far?
Good to see you. Yeah, busy as always, but things are good. Things are good. How about yourself?
Good, man. I'm excited for today's topic. We're going to talk about the Dexcom G7, which, for
Yep.
those who are familiar with it, it's a continuous glucose monitor. We've just recently, within the last week or two, got the Dexcom integration with Heads Up updated to support the G7. And there's some really important updates that they've rolled out from the G6 to the G7 that are important. And also, continuous glucose monitors in general are just
hmm
awesome. They're incredibly profound, but like anything, you can misuse them. And there's some downsides that we want to help people understand just so that you don't misinterpret the data or use the device incorrectly and actually start to make inferences or assumptions that might actually be counterproductive. So,
Yep.
lots to unpack here. But let's start with just what is the device in general. So, for those who have never worn a continuous glucose monitor before, you may have seen people with these patches on the back of their arm. And there's really two companies making these devices now. There's Dexcom, and there's the what's called the
Freestyle,
freestyle
Libre, yeah.
device. Yeah.
hmm
So we're going to be talking specifically about the Dexcom today, and I think the first thing, John, is just how transformational this is because you and I have been in
hmm
this game for a long time, way back in the early days of metabolic health and keto, and honestly, back then, and even still today, there's a lot of people that still have to stick their finger and draw blood several times a day. Now, you may be doing that
hmm
because you're trying to lose weight. So, for me, when I was doing keto, I'd check my fasting glucose first thing in the morning. And that number correlated pretty closely to how well I managed my diet and exercise the day before. So, if I woke up in the morning, I was shooting for 85. That was kind of like my bogey. And then I really didn't test for the rest of the day. So, whatever happened throughout the rest of the day, meals, exercise, it was really just kind of a black box. And then these sensors came along where they would start measuring glucose automatically every 5 minutes in the case of Dexcom. So it just
hmm
opens up a completely different window into what's happening with your metabolic health. So, as a practitioner, John, how have you seen patients adopt this? And maybe you can just comment on like how we've come so far from just old school glucometers, which you still need, by the way. We're going to get into that in a
Yep.
second, to where we are now with CGM and how that changes the game for individuals who want to understand their blood sugar.
Yeah, no, I mean, there's a lot to unpack there. I come at it more from like clinical experience where the people that were initially, checking their blood sugars by finger sticks were diabetics. And anybody who's either type 1 diabetic, usually type 1, or insulin dependent, they'll tell you their fingers are so destroyed from having to check their blood sugars 3 4 5 times a day, especially when they're making adjustments with medications or insulin usage. So when the CGM started coming to the market, I mean, that was a game changer for a lot of people. And if you know somebody or you are somebody who's had to check your blood sugar frequently, a lot of people stop checking because it's so painful. And so, once the CGMs came to market, it allowed them to at least have a rough estimate of where they're at. It's not 100% perfect. There are some limitations that we can discuss, but it allowed people to be more compliant, I think, because they weren't having pain of inject or of sticking their fingers. That's number one. Number two, from a cost perspective, every time you check your blood sugar, those little strips, now they've come down in price, but in the beginning they were very, very expensive. So for a lot of people, it was cost prohibitive to do that. Now, coming from kind of the low carb keto world, like yourself, I would check my blood sugar depending on what I was doing. If it was just a normal day, yeah, I would do the fasting glucose in the morning, give me a rough estimate of where I was. But like yourself, I mean, just the kind of the day to day having to check it multiple times became just not really efficient. And so I would forget. The only time I would really do it would be if I was doing some sort of experiment where I was maybe doing fasting or
Yep.
maybe a very, very low carb keto, and I needed to know the exact numbers. Now, once I had the CGM, that opened the doors for me in terms of what I could do because I could see correlations between different things, not just dietary, but things we can talk about later, I'm assuming, but sleep, exercise, sauna, cold plunge, meditation, things like that. But
Awesome.
also looking at specific food items that I thought maybe were triggering me, not like emotionally, but triggering blood sugar responses, things that I wouldn't necessarily think of. Like for me, dairy is a huge one. And especially in the low carb keto world where, at the time it was, doesn't matter what you eat as long as it's fat. And a lot of the fat that people would consume would be dairy. And so people would have a hard time maybe losing weight or getting their sugars under control. And that tended to be something that would trigger them. So just seeing that correlation, I think, was very, very insightful. And I think for me as a practitioner, and I think a lot of people, it's great to have information that is inferred, meaning that you don't have to do any invasive test to see
Exactly.
it. So like the HRV that we can talk about at a different live stream. Same thing with this. It gives you so much more information without having the invasiveness, besides just putting on initially. That I think really helps tailor people's responses to different things, but also how clinicians and practitioners adjust, different protocols for their patients.
Yeah, I say this every time I have a conversation about CGM, and it's very individualized. There was a study out of Israel that had
Hmm.
CGMs attached to, I believe it was 800 people. It was a significant amount,
Yep.
and they delivered the meals to these people. So everything was controlled. Everything they ate, everything they did in terms of sleep and exercise, it was all recorded. And what was fascinating was they determined that there's a lot pertaining to blood sugar that's individualized. And
Hmm.
there's this famous graphic where they showed two people who ate a banana, and
Hmm.
one person ate the banana and their sugar went up, and one person ate the banana and the sugar went down. So if you're looking to regulate blood sugar, is a banana good or bad? And that's
Yep.
why the CGM is so awesome, because you just get these data points every 5 minutes. I've been wearing a CGM pretty consistently for almost 2 years, and I'm still learning at this point
Hmm.
around how to control it all. And going to one comment you made, where you could actually eat something or ingest something like dairy, for example, and something you thought would be metabolically safe just based on reading the label. Oh, the carb count's low. There's no sugar in here. It's
Yep.
protein and fat. This should be completely metabolically safe for me, but it's not. And if you can start to eliminate those things 5, 10, 15 years earlier, before you have any metabolic condition, that is like the biggest, for me, the biggest promise is the prevention aspect of this. And if I
Hmm.
can make that change today, I don't have that elevated glycemic spike for the next 15 years unknowingly, and you're preserving that pancreas for the long haul. So I think it's just one of the most powerful sensors that's come on the market. And here at Heads Up, we test
Hmm.
everything. So if you haven't tried one, it's incredibly insightful. Just wear it for 2 or 4 weeks. See how high your sugar goes. See what things spike you. It's incredibly insightful. I want to transition, John, to just a few differences between G6 and G7 for those
Yeah.
Dexcom users out there. So go ahead.
If you don't mind, just before we do that, one thing I wanted to point out in that study, which is a very interesting one, and they actually, I think, are patenting the test to basically sell like individualized dietary recommendations. But it went so far as to look at the timing of things and how that affected the blood sugar in terms
Interesting.
of like
So
you could
when
eat the
after
same
ingestion?
foods.
Yeah.
Well, not even that, but just you could eat the same meal, but let's say you ate the protein component first before you ate the carb component, you would have a
Interesting.
less of a glucose spike. And then the timing of it in terms of whether it was in the morning or the night had a different response. So it's the point I wanted to make on that is that, you know, we tend to make recommendations that are very black and white. generally in medicine, like do this or do that, do low carb or do vegan, whatever. But there's so many nuances that the individual can maybe pick up with a CGM that otherwise you're not gonna find if you just go to your doctor every 3 months, 6 months, and do it like a spot blood check. You're not going to know this information. And as you mentioned, we could see normal glucose on a hemoglobin A1C or fasting glucose for 10 years while you're still having a insulin resistance type pattern. And we won't pick that up as a general lab marker, but you will see that in the CGM based on the delta, which we'll talk about later, on how much it spikes, how quickly it comes down, et cetera. So there's more information that you can gather on a CGM than just the absolute numbers as well. So yeah, but let's talk
Yeah,
about the
for me,
differences.
John. Yeah, that for me, John, that comes down to empowering individuals. An individual with
Hmm.
a CGM actually has more insights into their day-to-day blood sugar levels than the practitioner will ever have, unless, of
Yep.
course, they're connected to your CGM and looking at that data every day. But you're the one that's motivated to look at it every time you eat. There's no practitioner
Yep.
sitting there 24/7 at the controls looking at it and asking what you ate every time. So the individual now has significantly more ability to tailor this day to day. And then where this
Yeah.
really gets to, honestly, is it's very instinctive. It's not rocket science. You do something and the number goes up or down. It's very
Hmm.
easy to self calibrate. And what you eventually develop is mastery. And
Yep.
you start to develop mastery over your metabolism. And that is like the ultimate goal here, especially if you're interested in health optimization, weight management, controlling your energy levels, optimizing sleep. Everything comes down to how well you can regulate. And these devices, they give you really a simple tool to develop mastery.
Hmm. Absolutely.
So just a few quick updates. You and I have been testing the Dexcom G6 for the last few years.
Mhm.
With that device, you needed two separate pieces. You needed the part that you put on the arm here, and you needed a separate transmitter, and you would put the
Transmitter. Yeah.
transmitter into the patch, and it was a pretty expensive solution because you needed three sensors a month and a transmitter every 90 days.
Hmm.
So if it was covered by your insurance for the very small amount of conditions, obviously that would be not out of pocket. But for those who are using it for off-label use, like I was, the cost gets up to almost $400 a month. Now
Yep.
with the G7, it's just one device. So you just apply it. I think you have one
Yeah.
there. Maybe you can
I
just show
have.
people how
I
you
have.
actually apply this.
It looks like a urine sample, but it's. I don't know if people have seen the
It's not.
Freestyle Libre. It's similar to
Yeah.
that. I'm not taking a drug test or anything, so it's pretty simple. Again, there's a sensor here. I don't know if you can see it, the needle,
Yep.
and basically it's pop it in, push it in, super simple. Um, Very simple compared to previous ones, and also very similar to the Freestyle Libre. However, I think it's still more accurate than that one. So yeah, and then once you have it on, I mean, you have to calibrate it, which we should talk about. And then after that, you still want to calibrate it, a couple times just to make sure that the readings are accurate. Because sometimes, depending on where the needle goes, it may not be as accurate as you think it would be.
Yeah. So once you put this on, there's something that looks like a really thin wire. It almost looks like a human
Hmm.
hair. It's thin, and you don't feel it, but it just goes into the interstitial fluid. And
Yep.
and a few things I've learned over the years from doing CGM that I'll share just in terms of best practices. The first for me is I will always apply the new sensor the first thing in the morning when I'm fasted.
Yep.
Because if you put the sensor on, it takes 30 minutes to calibrate. You don't really want to have it calibrating when you're still in a postprandial meal state because it just
Hmm.
tends, this is just my experience, it just tends to throw the sensor off and then you start having to calibrate more often. So my best practice is wake up in the morning when you're not going to be eating for the next 30 to 45 minutes. Apply the sensor in the morning fasted. Once it
Yep.
pairs with the app, it needs 30 minutes to warm up. Once it's gone through the warm up cycle, get your glucometer and take a finger stick reading, and you can enter that into the app and it calibrates it. Like Dr. Lemansky said, depending on how you apply it, can make a difference. Some sensors tend to run a little higher, some tend to run a little lower. So just do it first thing in the morning, right when you wake up, give it 30 minutes, calibrate, and then you may want to calibrate one or two more times just in those first couple days, because I see a lot of people out there who don't calibrate it. They don't even own a glucometer,
Hmm.
and the CGM is still going to work. It's still going to go up when you eat something, and it's still going to go down as the glucose comes down. But to get those numbers as true to form as possible, calibrating it with the glucometer is essential. So I'd almost say that if you're going to use CGM, it's required that you
Hmm.
have a traditional glucometer. I use the Keto Mojo, which is
Yep.
great. It also does ketones. And then absolutely calibrate as soon as you first put it on. And then if you can, I just keep my glucometer right next to my in the bathroom in the morning. I just calibrate every time I remember. Even when I'm 6, 7, 8, 9 days in on a sensor, I'll still calibrate once in a while just to make sure that it's dialed in. And so
Hmm.
that's one thing, just calibrating. The other thing, John, maybe we can talk about is like there's always going to be, I think the documentation says that the CGM can be up to 20% different than what you'd get on a finger stick. So let's
Yep.
say you go eat your favorite lunch and the CGM is blowing up, saying you're at like 175 after you eat that.
Hmm.
You know, you can't freak out, first of all, because you could go check with the glucometer, and I've done this, and it's 155. You know, and there's a,
Hmm.
and that actually is within the range of variance for these things. So that's the first thing is it's less about that absolute number, in my opinion, and more important about how fast does it come down. There is something to be said about how high it goes, and that's important. I'm not minimizing that,
Hmm.
and choosing foods that keep you from going into those super high states. But that's not always necessarily a bad thing. There's lots of times where I'm going to eat a heavy carb meal, or there's lots of times when I'm going to eat big after I've been fasting, and that
Hmm.
same meal can take my glucose higher. So, John, maybe you could just speak about how to not misinterpret the CGM data in terms of some of those
Absolutely.
higher numbers and how fast it comes down. That's probably the biggest um, gotcha out there, is just people who
Hmm.
misinterpret what some of those readings mean, and why it might be high and how not to freak out. How would you comment on that?
Yeah, no, I mean, that's a very good point. I think first off, anytime you get way out of whack, let's say, so I've done experiments where I'm fasted for a long period of time and the sensor will read like 30, and whether or not that's accurate or not, it's hard to interpret. So, if the numbers are completely out of whack, I would definitely do a finger stick. Now, as you mentioned, I think the most important thing is getting your baseline, because the baseline is really telling you the underlying issue that you're experiencing. So if your baseline is around 80, let's say, or 90 or 100 versus your baseline is 200, and those are accurate, you can actually reproduce those with the blood sugar stick. That to me is the number one, the most important, because you want to have a resting baseline that is obviously lower. So if it's higher, you have to know, okay, something I'm doing is not working. That's number one. Number two, yeah, when you have those spikes, I think there's this misunderstanding that any spike is a bad spike. Because if you do a hard workout, like if you and I are playing tennis and I'm making you run, which happens frequently, if you were to check your blood sugar, it's going to go through the roof because you are, needing actual energy to try to catch those balls. Now, it'll come down pretty aggressively afterwards, right? Because your muscles are utilizing the glucose in your system.
I've
So
seen
that,
exercise push me as high as 180, John. Like really,
yeah,
really
sure.
extreme exercise, and I'm going
Yep,
in at a fasting glucose. I'm back to baseline, and
exactly.
exercise depending on the intensity. I'm not saying like a light walk, but like if I do an
Right.
extreme 90-minute hot yoga workout, or I do an
Hmm.
extreme tennis session. I live here in Scottsdale, and it's 110 degrees out. It's not uncommon just to see exercise spike me that high.
Yep.
It's not
Yeah,
bad, like you
and
said.
it's not bad at all. I mean, so again, like especially coming from the low carb kind of keto world, I think there's also demonization of any sort of blood sugar. I mean, if you don't have blood sugar, you're going to die. So it's you have to take it into context. And I think one of the benefits of having the CGM is to kind of understand, okay, when I work out hard, blood sugar goes up, but how quickly does it come down? Because the faster it comes down, the more like insulin sensitive you are, meaning that you can utilize the glucose in your system much easier. So, but also, as you mentioned, when you eat a big meal, if you have a huge spike, again, if you're concerned about how high it's going, maybe you need to double check the actual blood sugar to make sure it's accurate. That's number one. But number two, you should try to like pinpoint, okay, what is it in that meal that is triggering this huge disproportionate response? Now, if you're eating like a pint of ice cream, well, obviously you can expect it. But let's say you're eating something you don't think should spike it. Well, it may be the oil that you're cooking with. If it's, very inflammatory seed oil, I've seen patients have significant spikes in their glucose, even if it's not a carb heavy meal. It's just that inflammatory response.
Hmm.
So I think the takeaway point is, don't freak out about the numbers, but really look and see what is it that's triggering this response, because it may not be as straightforward as you would imagine. And then, like you mentioned, I think how quickly does it come back down to baseline? What's the delta? Now, if it
Yep.
takes a long time to come back to baseline, that is probably more significant in terms of looking to see the trigger than if it's like a huge spike up and then a huge spike down. That's generally says that you're metabolically more sensitive or able to respond to whatever that insult was to your system.
Well, that's a perfect segue, Doc. We want to look at some real data here, and let's go through. Let's actually look at some real values, and you can just talk us through how you would
Sure.
interpret that from the medical perspective. We're going to transition now into a live demo here of the Dexcom integration with Heads Up.
Yeah.
So,
And while you're pulling that up, I would also say there is a delay on it too. So as you mentioned, this goes into the interstitial space. So you have to understand that there's usually a 10 to 15-minute delay in terms of what you're doing and what the numbers reflect. So some people will be kind of confused that my blood sugar is saying 100, but my Dexcom is at 190. Why is that? Well, it could be the delayed effect from the readings as well.
can you see my screen, John?
Yeah, I can see it, but let me see how I can make it.
Okay.
Yeah, I can see it. It's just super small. So let me make
Yeah, let
mine
me just
bigger.
move
Yeah, I
this
can see it.
tab.
I can see it. There you go.
Okay, great. Yeah,
Yeah,
so
there we go.
this
It's
is
a little
this
bit
is the
better.
Heads Up platform here, and you can see that I have glucose as one of the metrics on my dashboard. And you can see that it's set to manual right now. So back in the
Mhm.
olden days, before they even had connected glucometers, John, you and I were in the game at that time. What you used to have to do is come in here and actually punch in your glucose, 85.
Yep.
Okay, I was fasted, and this was before exercise. That's we had to do it manually to get it into Heads Up. Then along came connected glucometers. Okay, so
Mhm.
that's pretty cool. Now I can use a finger stick and it'll automatically sync with my Heads Up account. That's great. And we support the Keto Mojo and others. And then we have the CGMs, which are even more advanced because it's just completely passive. Just apply the patch. You don't have to do anything. You just get incredible data. So to connect your Dexcom to Heads Up, when you land on your dashboard, you just come in here to connect data. You click on devices and apps, and you will click on Dexcom. It will then take you to a new tab. It'll ask you for your Dexcom username and password, and it'll sync. You can also connect your other devices here as well. So now I've got these readings that are coming in just continuously and passively, and that's really where you can get incredible insights, and we'll talk about those in a
Mhm.
second. I've also got on this dashboard, John, some other things that you might look at when you're looking to optimize blood sugar and metabolism. The first is fasting. And
Mhm.
you and I have done all kinds of crazy fasts. You were the first one to convince me to do a 10-day water fast, which, man, that
I'm surprised you're
was
still talking to
that
me.
that pushed me to my limit for lots
Yeah.
of reasons, mostly because I had that travel back and forth to Puerto Rico to do the fast. But I actually really enjoy a 72-hour fast. At this point, when
Mhm.
I do a 72-hour, I start getting euphoric within the first like 24 hours, and it's really just
Yep.
incredible. So you can track fasting on your dashboard. So I may have my CGM coming in, and I'm going to want to also set up a 72-hour fast. So I would just come in here, set the timer, and just crank it up to the number of hours I want to fast. And then you can start seeing what happens to your glucose as you go into deeper and deeper states of fasting. When I got into,
Hmm.
I think it was like day 7, day 8 of the fast, which means just basically water and electrolytes, my blood sugar was in the low 50s, and my ketones here were up around 4 or 5.
Hmm.
And that
Hmm.
is just like extreme downward metabolic pressure. That's the level that a lot of people go to when they're on, for example, let me get back to my
For
notes here.
cancer treatment,
Cancer,
yeah.
yeah, cancer,
Hmm.
epilepsy, where you have to
Yep.
push the ratio of glucose to ketones right to the floor. And
Hmm.
it's it's
Hmm.
it's really fascinating to experience that. So fasting and ketones, those are two other metrics you'd commonly want to use or look at next to glucose. And
Hmm.
John, one of the most empowering things people can learn is how to control these levers on their own. I'm not saying you have to fast for 72 hours every week, but do it once in your life and understand how you can completely control the level of glucose and ketones just through your own day to day choices. You
Hmm.
have so much control over your metabolism through diet and lifestyle, excuse me, that most people underappreciate. And once you learn that, you can never unlearn it. And you just know, like, okay, I can completely lower these levels on my own whenever I want to with relative ease. It's just a skill that I think
Hmm.
everyone should have. So these three numbers go together really good. Anything you've noticed from your fasts over the years, John, that you want to just add to that?
Yeah, sure. I mean, I think all those things are really good points. Most, I'm a very data-driven kind of person like yourself, and it's not so much just to have the data for the data's sake. It's to use the data to make changes and then to see, if those changes are causing something positive or negative.
Absolutely.
When
Yeah.
when you
Am I
do a
doing things
fast, I
correctly?
think exactly, and you get a positive feedback. A lot of medicine has become very negative feedback, and the relationship between a provider and a patient is almost like, an angry father or angry mother, where, you know, we'll tell somebody to do this, and when they come back and the response is not what we expected, we blame that person. Now, that's not a good way of enacting change. I think with the heads up dashboard and having these kind of numbers, you can show people, look, if you do this, this is what the response is going to be. And then as they do it, they get the same response that you said it was going to be. And that
Hmm.
positive feedback, I think, really helps change human behavior and patterns. Because I think that I look at, especially for a lot of people, they want weight loss, et cetera. I look at food as an addictive property, and I think food is made in a way where it's very addictive for people
It can be.
specifically.
Yeah. Hmm.
Yeah. Now, being able to show that if you change, your dietary habits, you're going to have this kind of response, and you're going to feel better, et cetera. But you're going to see these numbers start to trend in a certain way. That I have found to be a very, very positive feedback mechanism for people. Now, with the glucose and the ketone ratio, as you mentioned, I think that has a huge benefit for people to see, okay, I don't have to be on the carb cycle all the time where I eat carbs, I get a huge spike, I feel euphoric, then I get a huge crash, I feel like I want to murder everybody, and so I'm going to eat again. Changing the narrative that you don't just necessarily be on or on glucose based foods all the time. You can survive on ketones, and you see that when you start doing those fast, and the longer you do it, the more likely you're going to see the significant benefits. So I like the combination. The 72-hour fast for a lot of people is scary at first. They are worried that they're going to feel hypoglycemic and that they're going to pass out or go into a coma. As long as they're not on high doses of insulin, et cetera, medications, you can show them, look, your glucose can be in the 50s and it doesn't matter. My glucose gets down into the 40s, but when my ketones are in the sevens or sixes, I feel amazing. I don't need to be in the ICU. But if you were to show that to like a regular provider, they would say, "Oh my God, you are in DKA. You're going to die. You need to be in the ICU." So it's really changing our understanding of metabolism. And I think a lot of people are going more towards this idea of metabolic. What's the word, Dave? Where you flexibility, where you
Yep.
don't have to be hardcore keto, low carb. For a long time I was very hardcore. Now I realize there may be some drawbacks
True.
to that, and you need to be a little bit more flexible because if you're hardcore, unless you're doing it for cancer, epilepsy, as you mentioned, those kind of things, or genetic malformations, when you go back to carbs, you tend to have a very, very like massive response to the carbohydrate intake. So I found that you have to be a little bit more flexible with what you're doing, and a lot of that is really driven by the numbers that I see. So it helps me as a practitioner, but also helps patients, people to make small changes and see how their body responds to it. So I like those three together, and usually I'll do the GKI next to it just for visual reference.
Yeah, we have it on here. I didn't add it to the dashboard,
Yeah,
but we can do that. So if you want to add that
yeah, that's
on,
fine.
another one we'll commonly look at is the ratio of glucose to ketones. Again, this is mostly for people who are working on a metabolic therapy where they need to keep this
Yep.
down in a certain range for metabolic use case, cancer,
Hmm.
certain psychiatric things like epilepsy, bipolar. You have to really get the ratio down low. So we do support that here. Also, tracking body composition metrics; those are coming in from my wireless scale. As you start
Yep.
to get glucose under control and you start to be able to do an 18-hour fast, maybe a 24-hour fast, you're now stimulating those pathways, those SIRT1 pathways that start to lead to increased energy, um, better fat breakdown. You'll start to see the numbers on the scale improve. The clothes will start fitting better. You can also see
Hmm.
I've got my Aura Ring connected. Sleep is like the
Yep.
number one performance drug out there. It's also probably like one of the biggest levers in terms of weight loss. I don't think people realize just how important sleep is as it pertains to appetite control and weight loss. Like, just good
Yeah.
sleep is actually one of the best tools we have for maintenance. Good, healthy circadian rhythm, good, high quality rest, good deep sleep, good growth hormone release. Like, I think that's probably the most
Everything.
underappreciated weight loss metric
Hmm.
out there is just the quality of sleep.
Yeah, I mean, talk to anybody who's a new parent and dealing with baby up every 2 hours. It's.
I
I
think
mean,
I
I
think you have
was
some
used to it.
experience there, John.
Yeah, yeah. I have three kids, but before that, I had gone through medical school residency, so I was used to not sleeping. I will tell you that is the worst health, you know, or it's the most unhealthy way to live. Or if people who are shift workers, who work at night, their
Yep.
circadian rhythm is so screwed up, they will tell you it is nearly impossible to lose weight because, again, cortisol is rising. If you have high cortisol, you're going to have insulin resistance. It's going to be very challenging. So, yeah, I mean, for a lot of people, they could be so dialed in on the nutrition, but their sleep is horrible. You fix the sleep, all of a sudden, it becomes very easy for them to get their blood sugars under control, to lose weight, etc. So, I mean, for a lot of people, I'll focus on sleep primarily first. Again, everything is intertwined. So, I mean, if you're traveling, if you're drinking alcohol at night, if you're eating late at night, all those things are going to affect your sleep if you're stressed out, etc. And then the next day, interestingly enough, the next day, if you have a poor sleep, you are craving carbohydrates. That
Yep.
has been documented
Junk
in
food.
research. All that, yeah, junk food, yeah. So, yep.
Yeah, sleep for me, that's like the number one thing just I've noticed over the years as this has gotten better. It's just helped a
Hmm.
lot with weight loss, blood sugar control. And then, like you mentioned, making sure one of the great things about the CGM is you can just look at what your blood glucose was when you went to bed. The lower your
Yep.
blood sugar is before you went to bed, like you should be right as close to your fasting baseline as possible going to bed. Your sleep's going to be deeper, your HRV is going to be higher. So this just
Hmm.
lets you compare the two. Um, these GLP-1 peptides, these are a very hot topic in the market right
Yep.
now
Yep.
because they can be extremely effective for blood sugar regulation, appetite control, and giving people finally that window where they can
Hmm.
have enough appetite suppression that they can start to implement those healthy lifestyle changes in that window and then keep those healthy lifestyle changes, get the weight down, get all of the numbers back into optimal range, and then slowly titrate off the GLP-1s. I tested these. I did a cycle on these myself just so I could
Hmm.
internalize it and experience it. I had no side effects. I had really nice appetite control. I wasn't going crazy on the dosage, but I had some really nice changes
Yep.
in body composition. And like any good biohacker, I did all my blood work before and after the GLP-1, and I had the best labs I've ever had since I don't know, I was probably 25. It just works.
Yep.
It fixes all those lipids. It fixes. We can look at the numbers here in a second, but just to close out on the dashboard, a couple of the things you might look at: physical activity, sauna, hydration. You can build your own weight loss dashboard, and the CGM
Hmm.
can really be at the core of it. So
The
this is
core of
really
it.
starting
Yep.
to look at the big picture. It's not just glucose. It's what are the levers I can pull to help me keep this under control, and then what kind of output am I going to see? Am I going to see my sleep get
Hmm.
better, my body composition improve, my resting heart rate come down, my respiratory rate come down, all of the good things that can happen once you start learning how to master your own metabolism.
Yeah, Dave,
So
it may be good to show also kind of the trends. So, this is a snapshot
yeah,
in
let's
time.
crack that
Yeah,
open. So
because
let's look at a
I think,
specific example.
yeah,
I'm going to pull up my
because for
Dexcom
me
data
this
here,
is,
John.
yeah, do that, because for me this is even more important than the actual just absolute numbers, because the
Yeah, so this
trends
is my
are so
data.
much more important.
I hereby release everyone from their liability of seeing my PHI.
Yeah.
And I'm going to
All
pull
right.
up, oh, I think I have a year graphed. So this is going to take a
That's
while
going
to
to take some
crank.
day. Yeah.
Yeah, so this is a
Yeah.
full year of data, and you can see all the days I had the CGM. And when you're looking in heads up at anything more than a day, you're going to see each day represented as what we call the candle plot. And the candle plot are these bars here. And the height of
Hmm.
the candle plot is the high end of the reading. So you can see on this day, my highest reading was 150, and that shows up in the tooltip here. And the bottom of the candle plot is the low reading. I was a low of 68 on that day. And then the dot, let me just make it a little easier to see the dot. The dot in the middle is the average. So I averaged 107 on that day. So you have
Yep.
the ability to look back and you can see the highs and the lows and the control and when I had a sensor on and when I didn't. You can also see I'm looking at the current year, which was the last 12 months
Yeah.
compared to the prior 12 months, and I'm about flat. So you can see, at
Hmm.
least according to the CGM, I'm averaging about 95. The average alone isn't really the greatest number, but let's drill into a specific day. Let's look at a
Sure.
day where I had a really high spike, so we can talk about that. Yeah.
Yeah, and
So
we
let me
should
just
just mention that, this is not medical advice. Consult your doctor, et cetera, et cetera. This is
yeah,
more for informational
proper
purposes.
disclaimer, disclaimer, disclaimer.
Exactly.
So let me find a day where I had a really good spike.
Yeah,
There we go.
there you go. That's pretty
So
good.
like you can see, this is every hour throughout the day,
Hmm.
right? And I'm doing pretty good. I'm
Yep.
doing pretty good. I'm doing pretty good. Right around 9 p.m., bang! You can see it
Yep.
pop up pretty high here.
Yep.
This isn't a great example because I got to pop into the next day. So you can see right around 9 p.m. it started going up. Looks like it peaked right around
Yeah.
11. So this is like the 2 hour postprandial.
You
Typically
were
when you're
boozing
when
that
you're
night.
measuring, clearly I was had some late meal or who the hell
Yeah.
knows what was going on this day. and then it slowly
Mm-hmm.
starts to taper down. Let me find a better example where the spike. Here's a better example. You can
Yeah.
see it right during
There
the
you go.
day. So you can
Yep.
see it pops up. It goes from 108 to 148, and you can see it comes
Mm-hmm.
down quickly. So
Quick.
it's,
Yeah.
at least for me, yes, it's important to see how high it goes, but it's also important to see
Mm-hmm.
how fast it comes down. The true mark
Yep.
of how insulin sensitive you are is how fast does it come back to where it was before you
Mm-hmm.
started eating. So let's say I
Yep.
started eating here, up, down. Well, it's hard to see exactly when, but within 2 to 3 hours, within 3 hours, would you say, John, you want to be back to
Mm-hmm.
what your blood sugar was before you started eating?
Yeah,
And
I mean, I think 3 hours would be ideal. Realistically, I mean, even if you're super dialed in, 90 minutes
here's a
is going to
better
be
example.
probably average. Yeah. So you're doing
So
about
here's one where
60
I
minutes.
spiked up pretty
Yeah.
high, and then it
Yeah.
pops down pretty quickly. And as you start to make changes, you make dietary changes. You start doing more
Mm-hmm.
strength training, which means putting more muscle, lean mass on your body. You start doing
Yep.
fasting. You start doing cardiovascular. You start sleeping better. You maybe start layering in some of the peptides. You'll start to see that it starts to come down faster. That to me seems
Mm-hmm.
like one of the things that is really the kind of the pearl in here is less about the absolute high and more about like how fast can I get it down to baseline. For some people, it just doesn't come down for hours, or it can take multiple hours, 6, 7 hours to come down. That's where you
Yep.
need to do some work. Would you agree with that?
Yeah, no, I mean, that's a very good point that I think we should elaborate on a little bit. So, as you're making changes, people who like, here's a common scenario, and I'm sure you've heard this before. Um, you know, let's say you have somebody who's more obese than, let's say somebody's, I don't know, BMI of 40 and somebody has a BMI of 25 or 30, and they're both trying to lose weight. And the guy who's got a low BMI loses weight much faster. And when I say weight, I really mean fat. But and the person who has a higher BMI is doing the exact same thing or is even stricter on what they're doing, and they can't get it down. Well, if you look into their actual glucose numbers, you'll see when they spike, even if it's the exact same thing that they're doing, you'll see it'll take a lot longer for it to come down. And that is because, number one, their insulin resistance is much higher than the other person. Plus, you remember, so we did a webinar and we were talking about why is it that some people have a hard time on low carb. It's because they can't actually clear the receptors, the GLUT4, the GLUT1 receptors. You can see that on a graph like this, where it'll take them a lot longer to get that glucose to come down. Because if you think about it just intuitively, when you eat something and it gets into your, let's say you drink a Coke, for instance, and it goes into your bloodstream and you get this massive spike in glucose. Okay, so what's the response? Well, the response is insulin. But that insulin has to do something with the glucose, and that's to drive it into the cells. Which cells? So muscle cells, liver cells, fat cells. Now, if those receptors are sticky, you're going to have a harder time to get the glucose out of your bloodstream and into those cells. And that'll be
Mm-hmm.
reflected on this graph. Now, as you make changes, whatever those changes are, you'll start to see now the delta is much smaller. So it'll spike, but it'll come down much faster. That in of itself can tell you indirectly that you are making progress from the insulin sensitivity standpoint. So you can get a lot
Yeah,
of
just
information from a graph like that. Yeah.
Yeah, just to get a little deep dive nerdy here, John. I think we talked about this on the last webinar, but it's really measuring this
Hmm.
area under the curve.
Exactly.
And
When I say delta, that's what I'm talking about. Yeah.
yeah, so the faster it comes up and comes down, it's just a smaller area under the curve.
Hmm.
We're
Hmm.
actually here at Heads Up, we're working on some reports now for the practitioners out there that will help you track area under curve. And that will
Yep.
help you get a really good indication of how well a person's responding to the protocol. But the main thing is for an individual just having tools to come in here and then just cross reference what they're doing day to
Yep.
day with their glycemic response. And then if you're a practitioner and you're wanting to use Heads Up, we can now integrate the glucose data for you from all of your clients on a single dashboard. And we have some of the most powerful reports in the industry to help you start to look at your entire practice of people on CGM and start to get really, really detailed analytics on how each person is doing. What are their
Hmm.
baselines? How are their numbers moving? How are they performing relative to the cohort? How are they responding to the protocol? Who went out of range? We've developed a really, really powerful set of reports here. Got a little glitch on this one. I'll have to
Yeah.
just keep reloading it, see if I can get it to go. But there's a whole suite of CGM reports here that you can start to use to analyze this data across an entire cohort of patients. So we'll keep building on these. The area under the curve is the next one we want to add. But main thing today, John, was just to update everyone that the G7 is now supported. I'm going to stop the screen share here.
Yep.
And we'll go back to the webinar. Just to let everyone know, the G7 is now supported. You can integrate it on your dashboard. If you're a clinic and you're wanting to use CGM, whether it's Libre or Dexcom, we have the ability to integrate all that data in, build all the outcomes analysis that you need. And I'm just excited to see continued improvements. Just to
Mm-hmm.
drop a little bit on what I think is coming next, is you're going to start to see these sensors that can measure more than just glucose. So
Yep.
now you're going to have continuous feed of glucose,
Ketones.
ketones, lactate, maybe
Mm-hmm.
even other molecules that they can measure in there as well.
I mean, the
That are
holy
all
grail
going to
would
be.
be insulin, but that one I think will be a challenge to get. But I know there are companies that are working on it.
Yep,
But yeah, I
agreed.
mean, I think the more data you have, the more you can titrate what you're doing. Obviously, you have to kind of know what the data means, or how to interpret it, which I think we do a good job of demonstrating what those numbers are. Yeah, I mean, I think going forward, the last couple of years have, from my experience, have really opened people's eyes to how important it is to take your health into your own hands, or find a practitioner who is going to take you as the individual, and not just kind of be in the middle of the hospital system. So this is a good way to be able to capture that data and use it to make changes.
Yeah, I know in my hometown in Canada and across Canada, the CGM is not a prescription device. So anyone
Hmm.
who's curious about managing their blood sugar better can go to the grocery store and buy a CGM, which I believe that's how it should be. Here in the US, you still need to get a prescription. There are
Yep.
sites online that can get you prescriptions with just a telemedicine consult. So the barrier is pretty low, but there's still that requirement that you have to get an RX for it. Hopefully that
Sure.
changes, but in the meantime, if you haven't tried it, it's just, I think, you give me a continuous glucose monitor and an Aura ring on somebody, and I can get them 95% of the way there in terms of
Hmm.
getting their health optimized just through sleep and glucose.
Yeah, the other thing too on this one, which I don't think we mentioned, but the cost has come down also pretty significantly.
Yeah.
So, I think all in, you can get it for maybe less than 100 or 100, more or
Yep.
less.
Yep.
So I mean, I think from a cost perspective, it's definitely worth it for all the data, all the information you get out of it.
Well, thanks, Doc, for sharing the medical expertise
Yeah,
here. We've got the
absolutely.
technical integration done. So we love the CGMs. We love the way they integrate into Heads Up. If you're an individual and you want to use the dashboard, you can sign up headsuphealth.com. You can use all the tools we showed you here today. If you're a practitioner and you want to start using Heads Up in your practice for doing really, really precision medicine, including CGM, you can hit us up at support@headsuphealth.com. We can get you set up with a demo account. And John, we will talk to you next week, my friend. We'll have another update and another topic to chew on here. So thank you
Sounds
for your
good.
time and expertise, brother.
Yes, sir. All right. Cheers.